Hey, hey,
I
hey.
got a condo in Manhattan. Baby girl, what's happening? You and your ass invited. Now gonna get to clapping. Now pop it for a player, pop it for me.
What?
Turn around and drop it for a player, drop it for me.
And what? What's up, Bomb Squad? This is DC Kool-Aid and
Lisa.
and we're here about this Johnson & Johnson vaccine. Down in the comment down below, let us know if you actually got the Johnson & Johnson or the Moderna, how you call it, Moderna or the
Moderna or Pfizer.
or Pfizer. Let us know if you really actually went or you against it or you already got the shot. I actually got the first shot of the Moderna and we waiting on Lisa to get hers done because of the Johnson. Due to the Johnson, how you call it, since they stopped it, they giving all the other people that was going for the Johnson, how you call it, first dibs now
Yeah.
on the Moderna and the Pfizer.
Yeah.
So let us know down in the comment down below if you what is your concerns about this whole issue that's going on right now. Because when they first came, I ain't even gonna lie. When I had got the shot, I told my mom and I told everybody else, I feel like they experiencing on us. Then I kept on saying we all gonna be aliens one day because we took this shot. But that's just my opinion, because the way that thing hurt. But just like they stick you, you don't feel it. They don't even feel like they went inside you. So let's get on with this video, see what she's talking about. I want to say her name is Layla Harak. This Laila.
Layla.
Layla Harak. Let's go. We're going to see what she's talking about.
Johnson & Johnson says it will delay the rollout of its COVID-19 vaccine in Europe. That's after health authorities in the U.S. moved to suspend the use of the shot due to health concerns. While more than 6.8 million doses of the Johnson & Johnson vaccine have already been administered in the U.S., most with no or very mild side effects. But U.S. health bodies are now investigating unusual blood clots that occurred in 6 women under the age of 50. The cases appear similar to a rare clotting disorder European authorities say could be linked to the AstraZeneca vaccine.
So
let's get you more.
Wait a minute. So they saying 6 women out of how many people?
7 million.
7 million has passed on, right? How many people got sick?
I don't necessarily know.
I mean, it's still 6 people out of millions. But it's not like hundreds of thousands. You know what I'm saying?
Well, here's the thing. With anything with anything you introduce into your body, you run the risk of having some sort of reaction to it.
Right.
I could be eating eggs today, tomorrow I'm allergic.
Right.
You were eating shellfish up until you were 12. You ate a shrimp, your face blew up. You can't know what's going to happen when you introduce anything into the body.
Right.
Even natural things. That's the thing with viruses. It's like the flu, for example. Before it was COVID, the flu. There are people who could be around somebody with the flu and not catch it, and then tomorrow somebody walks in and as soon as they hit the door they catch it. Just depends upon the body. Now, if they continue to have issues, the reason they're pulling it, in my opinion, is because the vaccine got out into the public so fast.
They didn't do too much research.
They couldn't have. They didn't have enough time.
Yeah.
There are trials and research done for years before vaccines and medicines are put out. This was done in a year.
Right.
So
they
even
did
though
it, they did it too quick.
Well, not necessarily, because COVID is not old.
Yeah. It's new.
COVID, no, it's not.
It's not?
No.
I mean, as far as
COVID is like it's an opportunistic infection. You don't die from COVID. You die from what COVID causes.
Mm-hmm.
People are dying in the hospital from their lungs filling up with mucus. It's sort of like when AIDS came out. You don't die from AIDS. You die from the diseases that your body is now susceptible to because of AIDS. When you catch the HIV virus or anything like that, it weakens your immune system. It allows you to catch diseases that you wouldn't normally catch. That's sort of what I think it used to be H1N1.
All right, let's see.
It's not old. It's not an old virus. It's just that we didn't have the need to rush the vaccine until it was allowed.
Because I just think, like today, scientists, I don't know.
It's all about
it. It took me a minute before I got it because I was a little. I'm not even gonna lie to you. I was a little nervous of doing it, and I still got to do the second shot. And Charles had a lot of side effects after the second shot, where he was sleeping and feeling loopy. So we'll see.
More on this. We can speak now to Eric Fengding. He is an epidemiologist and senior fellow at the Federation of American Scientists in Washington, D.C. Doctor, thank you very much for joining us. What do you make of this decision?
Well, I think this decision, I want to emphasize, is a very brief temporary pause. The FDA says it might be just a few days while they investigate out of abundance of caution. There's 6 cases, but there's 6 cases out of almost 7 million vaccinations delivered. To put that in perspective, that's 1 in a million. That is 10 times lower than what you observe in Germany and 4 times lower than what you observe in the UK. So this is a very, very low risk thing so far. And Johnson & Johnson is not a major vaccine yet. It's only 5% of all vaccines currently delivered into the arms in the US. So I think it's an abundance of caution, and the risk is much lower than what you've seen with AstraZeneca.
So what does this mean for the mass vaccination plan underway in the US? I mean, will the impact be minimal?
Yeah, I think the impact will be very minimal. First of all, it's only for a few days, we believe. And Pfizer and Moderna, we are rolling out 25 million doses in the United States a week of Pfizer and Moderna. And again, Johnson & Johnson is only a small 5% of all the doses delivered into each arms. So it will be very minimal. The pause will be very short. The risk is much lower than what we've seen. And it's out of abundance of caution. The main reason I think they said they did this is because it's a very unique type of clotting that is very rarely seen. They think it's an autoimmune, perhaps. And the drug heparin that normally treats clots doesn't help this. So they want to just put this out as a warning that occasionally we might see this. It will not affect U.S. vaccine rollout in any way.
Now, obviously, we are trying to keep this in perspective, and you're doing that as well for us, but this is not going to help with vaccine confidence. How worried are you that the pause of yet another vaccine could stoke global skepticism about COVID-19 inoculations?
Right. I think in certain ways, obviously, it's very frustrating for AstraZeneca what happened. In Johnson & Johnson, some say it's maybe a class effect because it's the same adenovirus class, a different type of adenovirus. But I don't think it should affect hesitancy of the mRNA vaccines, of the other vaccines, Novavax. They're completely different classes, different worlds in terms of how they were built. But I think this is, again, extremely low risk. The Johnson & Johnson, they're actually testing another booster shot. They haven't paused that trial yet, to my knowledge. So I personally think this will be a temporary pause, and once we clear it up that it's not related, or that it is, but perhaps incredibly, incredibly low compared to the actual known benefits of this vaccine against a very heated pandemic, I think overall it would not make that much of a dent on hesitancy.
All right, Dr. Eric Fengding, epidemiologist and senior fellow at the Federation of American Scientists in Washington, D.C. Thank you, sir, for your time.
Okay.
I don't know. I mean, we was playing, I'm not even gonna lie, we were playing, talking about the Johnson & Johnson one is for like, who was that saying Johnson & Johnson, it was like a low income thing to go to. You know what I'm saying?
Well, I mean, I hadn't heard, other than when they started yesterday when I was out in the car.
Mm.
All I heard was the Johnson & Johnson, they did not have the same effectiveness as the other two. That's why.
Speak now to Eric Fang.
Effective while the others were up in the 80s and 90s. So as far as I mean, I don't think it matters. I don't think their income matters because the shot is free.
Right. But they were trying to say people were getting that one because it's a one-shot thing.
Yeah, that's, I mean, you don't want to have to go back. I guess you don't want to have to
Go back twice?
Yeah. I mean, it was convenient.
Yeah.
But
Yeah, because it's like you have to be on the waiting list. But like I said, down in the comment down below, tell us how y'all feel about this whole situation with this Johnson & Johnson thing. Because then it make it scary because this thing is even though it was 6 people out of 7 million, that's like a low percentage of people, passing away back to back. But what if you that percentage of that one person? You know what I'm saying?
I mean, I know it's going to sound bad, but the reality is that in situations like this, you run risk. I mean,
It's just, I don't know.
it's either you take the shot and you're more likely not to catch COVID. Don't take the shot and you run the risk of catching something that in reality they can't cure it. Now,
Right.
there are some people who are asymptomatic. Some people test positive and never have symptoms. Some people test positive and they have a few flu-like symptoms and get over it. Some people test positive and don't make it home.
Right. So that's what I'm saying. So
And I mean,
it's
if all
scary.
they had was Johnson & Johnson, the reality of if the only shot they had was Johnson & Johnson shot, the reality is I would take my shot
Right.
because 6 out of 7 million is like 0.01% out of 100.
Right. Because I seen people on Facebook and YouTube, they actually took the Johnson & Johnson and they actually caught the flu. So I don't know.
I mean, you gotta understand there's no correlation between that.
I don't know. They said they got
might
sick.
have flu-like symptoms,
Mhm.
but
They got
COVID
sick.
starts off with flu-like symptoms.
All right, guys. Anyway.
But see, here's the thing: the COVID shot is specific. It does not stop all viruses like that. It is specific to COVID. It's like anything else. We used to get the shots for polio.
Mhm.
Polio shots weren't gonna do shit for our chicken pox. We get the chicken pox shot. Chicken pox shot wasn't gonna do nothing for our measles.
Right.
It's very specific. It's not COVID. A COVID shot is not gonna stop you from getting the flu.
Right. All right, guys. Go ahead and hit that like button, share, subscribe, down the comment down below. Give us some input on what your thoughts and process about this whole Johnson & Johnson thing that's going on right now. Don't forget to hit that like button, share, subscribe, hit that notification bell. Every time we drop a video, you don't want to miss it. All right, we out.
Bye, y'all.
Peace.
Yeah. DC KOOLAID and Lisa doing challenge on your head top. Yeah, you know what's happening when you tune in. Story times, pranks, and vlogging, man. We a great big family, we the bomb squad. We on that grind to a number with a K, best believe you'll stay. You can chill with the fam like most of y'all do. DC KOOLAID, Lisa, and Nick too. With Charles and Barbie living that YouTube life. We love our fans and supporters, we a family dude. So come on down to Bomb Squad Town. Have a seat watching videos. And nobody likes to hate. Keep it positive and have a nice day. Oh, I forgot. Smash that like button. Bomb Squad. Bomb Squad. Bomb Squad. Hey!